Your Excellencies, ladies and gentlemen, dear colleagues. When MediPIET design started in 2013, we knew that there are increasing risks in the region, that the countries around the Mediterranean share common challenges, and that there was a need to standardize procedures against public health threats. The FETP, the regional FETP, was built taking into account the country's needs, the international and the regional contact, based on previous international experience on FETPs. MediPIET is already mentioned in this room, to address communicable diseases and communicable diseases threats of any origin, including the CBRN incidents and threats, in order to increase capacity with regard to prevention, detection, and response to communicable diseases in an integrated approach according to the principles of the IHR and the health security agenda. So the main aim of the newly established program, the newly established fellowship in 2013, was to enhance health security in the Mediterranean and Black Sea countries, and to build capacity for the prevention, detection, and response to communicable diseases. The fellowship developed included 2 years on-the-job training, learning by doing, procedure complemented by 9 modules, in order to change the working environment configuration in the public health institutes, in the training sites. External participants were able to join the 9 modules and to be initiated in the new working methodology. Supervisors and trainers were supported and trained, and scientific work was presented in the annual scientific conferences. The fellowship explicitly included the components of our strategy and of our objectives. Detection was present and is present in the fellowship, in the development of new surveillance systems, in the evaluation of the old ones, in getting acquainted and used to the alert systems, epidemic intelligence, management and detection of CBRN threats, risk assessment, and other components. The lists are not complete. They are indicative. Response is mainly present in the fellowship, in outbreak investigation, using analytical methods that the countries had recognized as a lack in their curriculum and in their capacities, and preparedness in developing standard operating procedures, in the functioning of emergency operation centers, risk communication, and management of humanitarian emergencies. Prevention. Our fellows and participants are trained to recommend prevention measures during the outbreak investigations and the research protocols, using analytical methodology to have an evidence-based recommendation and prevention measures, and to evaluate these measures by using the surveillance systems. In fact, what we have come up during these last 4 years is 22 fellows in 8 training sites, 4 additional training sites appraised, more than 700 seats for external participants, and more than 300 seats for facilitators from the countries in the project and in the EU. We have worked with almost 25 supervisors in the training sites, and the network is here with more than 150 professionals. Overall, at least 22 surveillance systems were developed, at least 22 outbreak investigations in the training sites were performed, at least 22 research protocols were designed and implemented, and oral communications and publications shared the scientific content of the fellows' work. Qualitatively, what was made possible during these 4 years was to implant the new methodology, the new working methodology in the training sites. This project, in addition, is a unique interface with regard to field epidemiology between the EU and the non-EU countries. Further, the material and the working methodology has started to be cascaded within the countries as it started to be used in national training programs, and working relationships were developed with other programs in the region and internationally. So this phase is ending on the 31st of December. So the question was, since last year, what will be next? What shall we do? Last March 2017, countries came up with a new concept note suggesting to have a 10 years fellowship and requesting the funding from the European Commission. The background, where did this concept note come from? IHR core capacities and health security agenda are still there, and they are still there because emerging and re-emerging threats and diseases will always be there, and the country's needs are still present. Further, we know that developing the capacity for the standard surveillance, outbreak investigation, research questions guides us to develop capacity for the rare, the serious, and the emerging, the unknown. In addition, many of the countries of the region are already under public health system reforms and reorganization for different regions, and countries, most of them have identified their increased needs to increase and strengthen their national training capacity in field epidemiology. Instability is still there, and the geopolitical context we all know is such that one of the major symptoms is the refugee crisis. On the other hand, the engines are on. The impact cannot be extremely visible at this site, but legacy is there. It is a good starting point for further development. It is acknowledged that the national FETP and the regional one can have complementary roles. It is a practice, it's an experience within this project, and we all know that it is the most efficient tool to increase capacity. On the other hand, countries do not see why they should set apart, while tendency overall in the world is to strengthen and to build partnerships, as it is urged within the global health security agenda. It still consists, this project, a unique interface for EU and non-EU countries with regard to field epidemiology. And on the other hand, we have long-standing, very successful examples at the international levels of field epidemiology programs, either at the federal or at the regional level, who have a very important impact, not only for the countries, for the regions, but at the international level as well. So there is a context. Things to be considered for a new phase is how to focus on the results, on the effectiveness, how to increase efficiency, increase the impact, eventually how to provide, to work closely in a tailored way with the countries in order to increase the national impact, and to consider ways for a different countries' involvement. Thank you very much for your attention.
Good morning, ladies and gentlemen. Dear friends, Your Excellencies, Your Majesties, if we have. My name is Marko Milivojević. I'm a Serbian national focal point for CBRN in this COE-CBRN initiative of European Union. I'm here from 2008, so I am not old, but oldest focal point in this initiative. And I would like to thank you to MediPIET organizers for the invitation for this event. Organizers are shaking a little bit now because I have a written speech for 25 minutes, but I will try to be a little bit shorter. and try to give to you some main points. In the same time, I am deputy head of the regional secretariat in this initiative for the Southeast, East and Eastern Europe. Regional secretariat are based in Georgia, Tbilisi at the moment, and we are one of 8 regions, regional secretariats in this initiative with more than 60 countries at the moment and with more than 20 observers countries. So these 10 countries in our region are Albania, Armenia, Bosnia and Herzegovina, Georgia, Macedonia, Moldova, Montenegro, Serbia, and Ukraine. And finally, before a few months, we received the letter of Azerbaijan. So it will be 10th country in our region too. So we had, in February this year, we have annual meetings of national focal points. We had one of these meetings in Skopje in February this year. And we received very positive impressions about MediPIET project. So, in the other hand, European Union have an European Commission. One good thing, this is Court of Auditors. It is a very important issue to check for the projects, how we can dealing with these projects. And we already gave positive impressions to the Court of Auditors. So this is very important to know. About interregional cooperation, because this is one of the new, let's say, bullets in our COE initiative. We have in this project more than one region, exactly 4 regions. 4 regions are involved in this project, so this is very important. And we have network. Network is one of the main issues in this COE CBRN initiative. And, of course, it is very important to know that we have not only members of COE, participating countries in this COE CBRN initiative, but we have non-participating countries from Mediterranean area. About national benefit, I will tell you something about experience of Serbia. So, as the Serbian national focal point at the internal level, this project has helped to create a good network and cooperation within Serbia, especially with the Institute for Public Health Milan Jovanović Batut, where I am, and I hope you all are convinced that the Republic of Serbia has very appreciated and significant experts in this field. Furthermore, these experts have helped us in drafting the National Action Plan for CBRN, and it seems to me that without them, this job was not possible. Now I have many friends there who are always ready to help and cooperate. I emphasize this aspect as an example of good practice in national frameworks. So you have to know Serbia is an EU candidate country, and we have to harmonize our activity. In European Commission, they call that acquis communautaire. So we have chapter for negotiation with EU, chapter 24, freedom, justice, security, and in one of these sub-chapters, in the framework of fight against terrorism, we have to develop national action plan for CBRN. So we already do that in our country. And this Institute for Public Health help us a lot to develop this National Action Plan, and this plan is totally in line with CBRN EU Action Plan, just to know. So DG Home will be very happy about that. Of course, this is on the basic initiative for this was from DG DevCo, just to know. So we have some kind of coordination between a lot of DGs in European Commission here in the same place. We have network and we have good internal cooperation, just to know. So the results of the project are impressive. They are sweet fruits, but now they mean a major obligation for the EU, the obligation to maintain this essential and very important network by bonding it with other activities in the future. I'm a police officer. I'm working in the Ministry of Interior. I'm not doctor, like you are. We are strongly believe that virus is coming from the from deep space. And now is your turn for the second phase of MediPIET to tell us how to fight with aliens, with viruses. How to fight. How to fight on the first line of defense with bugs in the head from millions of refugees. How to fight with scabies. I'm a lawyer, I'm not a medical person, but you know what is scabies. We found that on the skin of refugees. How to find the way, the right way, to fight with bioterrorism. You have to teach us. This is your job. Thank you, that's all. Thank you for your attention.
Thank you, Nisef. Good morning, everybody. I am Dr. Hana, Director of Epidemiology and Surveillance Department, Ministry of Health, Egypt. I'll tell you about impact and uses of MediPIET in contribution of Egypt Ministry of Health and FHB program. Egypt acting as a participating countries in the MediPIET since November 2014 because Egypt has its own public health activity mediated by preventive sector Ministry of Health, including FHB program. Up to 34 epidemiologists participated in 2 modules distributed in cohort 1 and cohort 2. 11 expertise and decision maker participated in TOT and summer school. Also, 5 facilitators participated in 10 modules. The participated trainee selected in different sector in preventive sector of Ministry of Health. Also, using the training material in FHB, in the MediPIET program, in Egyptian fellowship and FHB program, like case study, hemorrhagic fever in the ear, gastroenteritis in Ireland, selected some topics, selected some slides, sharing the presentation and slides between FHB resident and MHB colleague. Also, data management using the time series analysis and multivariate analysis in analysis of public health surveillance data like avian influenza manuscript formulation. Also, sharing in review module as a rising capacity in FHB building, in review module before annual scientific conference, in sharing the experience and communication skill, critic the abstract and scientific presentation, sharing in conference Of total 3 conference, we sharing 25 accepted abstract from 30 submitted. In 2015, 5 abstract. In 2016, 7 abstract, either oral or poster. In 2017, we have 14 abstract from 18 submitted. Also sharing in networking and sharing the experience, recognition of public health situation in neighboring countries, understanding the health system and public health threats in other countries, TOT training, strengthening the relations with ECDC in public health threats and epidemic intelligence. What is the beyond 2017? We hope to be establishing the training network for all participating countries to train more epidemiologists at the level of each country, sharing the capacity of countries having already FHB with other countries, involving IHR and CPR in focal point in all countries in MediPIET activity, and finally involving more decision maker in TOT. And lastly, I want to acknowledge and thank all MediPIET team, ECDC and the Ministry of Health Preventive Sector and Department of Epidemiology and Surveillance. Thank you.
Good morning, everybody. Good morning, ladies and gentlemen. I'm Dr. Yasser. I'm Director General of Public Health, the Minister of Health, Palestine. I would like to thank the MediPIET for the opportunity in order to present the Palestinian experience with the 4 years with MediPIET and our expectation and needs for the upcoming period. First of all, I want to give a small review about Palestine and the unique situation that we have in Palestine, because I believe that we the only country in the world that we're still under occupation, under Israeli occupation. And the unique situation in Palestine is that we are geographically separated country. I don't know if it's working or not. And as you see here, Palestine is consistent of West Bank and Gaza Strip, which is completely separated from each together. We do not have any access except the technology of using, and we are communicating each other like communicating any other countries in the world, despite we are one country. Our state is a young state with a young population. The majority of our population is under 15 years old. Almost 40% of our population is under 15 years old. The unique situation also that has been imposed to Palestinians and to deal in daily basis is the occupation and the apartheid separation wall here, if you see, which make even the West Bank separated each district from another, which means that we should, as Ministry of Health, in order to improve the health of population, to make health access available to all citizens in different districts, which imposed and make to us a burden financially and lack of staff all the time. So because of that, what we are starting to do is to do, each district can stand by himself alone in order to face any challenges that he could change. And if we are compare the apartheid wall here with the famous Berlin Wall, we will find that our wall is 30 times in length more than Berlin Wall and double time in height than Berlin Wall. I'm not here to talk about the political situation in Palestine, but this is in order to understand what is the situation in the field in Palestine and what is the importance of the FATP for Palestine in order to overcome any challenges that we can face due to geopolitical situation in the field. What we had been achieved till now with the MediPIET, lastly has been appraised as a training site, but we don't have any fellows till nowadays. What we expect that it would be in the next cohort. We have external participants from different staff, doctors, lab technicians, public health practitioners, environmentals, and others. And if you see that there are here also from other countries, people are not only from medical staff, even from police departments, because the diversity of the modules that has been imposed by MediPIET make more easier that people can interact even between themselves in the same country, because as you see, medical personnel are working by themselves, the policeman and department and etc. And we are all believe that public health is the responsibility of all, and not only the Ministry of Health in the country. So all together should work in order to improve and enhance the public health in the situation. What we gained also that we increase skills, knowledge, and practice of our participants, and we sharing experiences with other countries, and we are speaking common public health language, and information for action has been brought in place. There's a better collaboration started since our national center, our training site will be in the governmental preventive medicine department with a high collaboration with the Public Health Institute, which is in our country, is not a governmental one, and the fellows will be from the governmental staff, and the fellow will train other networks. So what do we expect from being a training site and from the MediPIET in the next future? And in the expectation that we put, it's not only the expectation, but also we're planning how to sustain after, if the MediPIET will not continue, or will we continue for 5 years, 10 years, how we are as a country to sustain such type of program, since we are all agreed that it is one of the best programs that has been implemented for the training. So what we are thinking about is the cascade training, since we have 2 fellows in each 2 years, and these fellows will train other people when they are coming back to the country, and those who had been trained by the fellows should train other people. And I will look to the time. I have only 3 slides. So our next expectation is the networking, because from MediPIET team and MediPIET countries, we established a networking, and yesterday there have been discussing of the role of TCF, and it will be and could be the major role of communicating countries together, because our colleague from DEFCO said in the morning that we need visa to come to Brussels, but our viruses do not need. So I believe in order for rapid and information sharing and experience sharing with others country, the TCF could serve as a background and database for that. And also there's a slogan all over the world. Nowadays we are talking about one world, one health. So our problem in Palestine is the problem for Europe. The Ebola virus that has been discovered in Africa, it has been the problem for all the world. Okay, maybe we don't have Ebola in Palestine, but we should be prepared in the proper way in order not to have, and if we have imported cases, how to deal with these cases. And the Zika and the SARI and whatever it is, because nowadays I am in Brussels, tomorrow I will be in Palestine. With all viruses in Brussels, I will carry back to Palestine. So I believe that my public health system should be prepared in the proper way in order to deal with any imported cases, in order to deal with the slogan, one world and one health. And the globalization is also the same issue, and people are moving easier than previous. The EU is one example. I'm here today in Brussels, tomorrow I will be in Roma, after tomorrow I will be in Germany, etc., etc. So also the public health system are facing more and more challenges in order to deal with the emerging and emerging diseases. And in order to sustain, we are thinking about consultation with local university for academic accreditation for such program, in order to be in place for more incentives for our staff to deal with such system. And the last slide, Dr. Insaf, that we are trying to link, and one of the most important things is the IHR. The main core competences is the human resources. We are thinking that we should increase the capacity of our human resources, leadership, skills, and etc., in order to improve human resources, that they could deal in the future with any emerging and re-emerging diseases that could face in the future, any threats or any migrants. I took more than 3 minutes. It's the last slide. So I believe that public health in the world, and it's the public health, it is in the country, but nowadays public health is all over the world. So I believe all we should be prepared in the proper way, and I believe that FATP is one of the most important things that can deal with. Lastly, I would thank all of you, and thanks MediPIET team, EU and ECDC, supervisors, trainers, and our committee host partners. Thank you very much.
Good afternoon. Thank you, MediPIET, for the opportunity to speak about Armenia. I will present you the success story of MediPIET in Armenia. Well, Armenia is a small country in Transcaucasia region, and during last decades it has undergone through earthquake, war, and currently is in a very complicated geopolitical situation. During last couple of years, a few number of Armenian epidemiologists participated in South Caucasus field epidemiology training program. But currently this program is over now, and we didn't reach the critical mass of needed epidemiologists in country, unfortunately. As Armenia is a post-Soviet country, we hosted our health system from former Soviet Union, and it's not complementary with country's current needs and current resources. So our government has a vision to modernize our public health system and to harmonize the communicable disease surveillance system with European approaches. So we have become a training site very recently in May 2017. So far, Armenia have sent several participants to MediPIET different modules, and these participants had a huge contribution in development in strengthening of analytical methodology, development of surveillance system for vector-borne diseases, and development of our scientific communication skills. What we did in order to institutionalize what we have gained. All the modules were translated in Armenia. National public health curriculum was revised based on MediPIET training materials. And a training center was established on the basis of national CDC. And some cascade trainings were organized for epidemiologists and public health specialists in Armenia. We have revised some of our national guidelines and normative documents based on the gained knowledge. We have also established bilateral collaboration with Georgia, Moldova, Ukraine. We had a very fruitful collaboration with France, Serbia, Albania, which helped us in development of our national public health law. And what we would like to have sustainability for our national training site. We would like to epidemiologists to learn and implement analytical methods in Armenia. And we need MediPIET to train supervisors and fellows in order to lead the modern epidemiology and in order to have enough capability to train others. And also, we would like to develop our scientific potential of our specialists. Thank you.
Ladies and gentlemen, dear colleagues and friends, I would like to share some ideas how MediPIET training program influenced the Republic of Moldova and how Republic of Moldova benefit through this project. I would like to mention that Republic of Moldova, along with other presented here countries, are working to implementation of international health regulations, and countries have to be aware to early detect, conduct risk analysis, and to manage in the proper way any kind of public health threats. And of course, to manage this issue is to have enough human resource capacities. And another important area of work what Republic of Moldova is involved now, in 2014, Republic of Moldova signed the association agreement with the European Union. This agreement commits Republic of Moldova to work on harmonization of the legal framework to European Union acquis, and the second, to increase the quality the standard quality in different areas, including education system, public health system, and other. Of course, this process was required to conduct continuous performance evaluation, and monitoring and evaluation of implementation of these two documents. That's why one of the big components of this assessment was public health human resources. Based on this assessment was established some critical points related to human resources in public health. I would like to mention that Republic of Moldova today is facing a huge problem with migration from Republic of Moldova to other European country, and this caused the shortage of staff. And another, let's say, critical point was identified as curricula for professional training was out of date and need to be updated in order to be ready to respond to meet the society requirements and also to be aligned to international standards. Another big part of troubles was related to lack of social, economical, professional system for staff motivation and attractive opportunities for young specialists. So in this context, MediPIET was for Republic of Moldova like a huge opportunity to move ahead, especially when we speak to revise the curricula for professionals and to increase the quality of the training process in the area of field epidemiology. So in 2015, National Center of Public Health was designated as MediPIET training site, was created a coordination mechanism what help us to manage all aspects to implement this project in Moldova. And it's good that this mechanism was a platform for communication between epidemiologists, specialists or representatives from the medical university and School of Public Health and Ministry of Health. And this platform facilitated the communication between all partners. Also was developed an action plan to implement all activities. So I would like to reiterate some early evidence of MediPIET impact. So first of all, we managed to improve the capacity of human resources in the area of field epidemiology. Our colleagues have opportunity to be trained during the international training of trainers events in different areas. We have two amazing and very good fellows, 3 modules from the MediPIET program was integrated into master program for School of Public Health and other training activities. A lot of person was trained, and in November this year, we started to conduct cascade training on zoonotic and vector-borne disease. Another area where Moldova benefits from the MediPIET is revision, harmonization of the legal framework. And the main word I would like to mention here is quality. This project brought to Moldova additional quality to develop good regulations and then to try to find the best way to implement the legal and regulatory framework. So was developed the governmental decision on early warning and rapid response system. We start to revise the national guideline, intersectoral one for outbreak investigation, other documents, was developed the communication strategy. Another area was surveillance system, what was improved. Several aspects of this surveillance was developed and now is in the piloting process, electronic information system on immunization, harmonization of surveillance system to international WHO and ECDC protocols. Here I present SARI and measles. MediPIET team now is working actively to introduce a new vaccine against human papilloma virus and other activities related to strengthen the emergency preparedness and the management of public health events. Of course, MediPIET also support and help us to improve our intersectoral collaboration because during the training activities, we invite as participants our colleagues from other sectors, but also MediPIET team participate to share their knowledge and experience during other CBRN projects like the project for first responders where our colleagues present and were involved as facilitators. Also, I would like to mention that Moldova hosted but also participated in several international assignments, and this was another huge opportunity for our young epidemiologists to share their experience, to share the good practices and bring back to the country the practices in order to improve the surveillance, outbreak, and other aspects of public health. So we have good collaboration with other public health institutions like Macedonia, Norway, and other countries. Now Moldova initiated the process to participate in international WHO GOAR network. So what will be next step for Republic of Moldova? First of all, team have to be focused on revision of legal framework to improve and to find the appropriate mechanism for recruitment of public health specialists, to offer to all epidemiologists training opportunities and career development opportunities in order to keep professionals in the country. And speaking about the regional approach, I would like to mention that this amazing project not just or contributes to increase the regional or national capacities, but this amazing project change mind, change opinion, approach to education process in general, speaking about the field epidemiology. So we would like to continue to implement this two years training program to strengthen, and Moldova can contribute to strengthen MediPIET network by organizing different events. And of course, we have to create this critical mass, what needs to change and what needs to improve our life and contribute to global health security agenda. And at the end, in conclusion, I would like to mention that working in this area is like to invest in the future, invest in the new generation of new professionals. I would like to wish everybody good luck and stay healthy to implement all our ideas.
Your Excellencies, dear colleagues and friends, first I would really like to thank you, the organizer, to giving me opportunity to tell you a couple of words about Montenegrin experience regarding participation in MediPIET. So our story starts with the EU and ECDC joint assessment of Montenegrin's capacity that was done in June 2013, since Montenegro is preparing to join EU family. And based on this recommendation, and in fact this assessment that identified the weaknesses and a couple of strengths of Montenegro, we prepared the action plan for improve our national capacities regarding surveillance, prevention, and control of communicable diseases. After that, Montenegro joined MediPIET in February 2015. So it's less than 3 years. You will see in further slides our experience. Participation in training during 2015 improved our skills and the critical mass of skilled epidemiologists that led to the first step. First, establishing of training sites in National Institute of Public Health of Montenegro. That helped us really to establishment of the Center for Research and Continuous Medical Education. That will in the future, and we do hope that it will be done in the next 3 to 5 years, to develop our national field epidemiology training program. So really, this establishment of training site was the most important step toward developing national field epidemiology training program. And we must say that it was direct consequences of participation in MediPIET. After 12 months of experience with MediPIET, we made a consultation with the Ministry of Health in order to convince them to provide support to our program of continuous medical education and the cascade trainings of public health workers. Result, now we have a full commitment of Montenegrin government for improving the system of surveillance, prevention, and control of communicable diseases. So now a couple of words about cascade trainings, and I would really like to emphasize the other very important contribution of the MediPIET. It gave us an opportunity really to connect respectable public health institutions as well as the individuals from the region that support us. Since Montenegrins consider themselves as Spartanians, we were thinking that maybe it couldn't be a bad idea to invite the Athenians. Let's try to do that together. So we signed the Memorandum of Understanding with the National School of Public Health from Athens, Greece, and they also invited their colleagues from the National Center for Disease Control and Prevention. So during 2016, we prepared our plan for cascade trainings. And then during 2017, we performed 4 5-day trainings courses for epidemiologists and fellows in Montenegro. And up to now, more than 30 of them passed 2 courses of introductory course in surveillance and outbreak investigation in May and June. And then after that, 2 courses of using of EpiInfo in outbreak investigation. After that, we also invented a couple of new activities. So up to now, we perform 18 2-hour sessions of critical analysis of outbreak investigation that was published in international scientific journals in order to sharpen our eyes and minds regarding outbreak investigation, as well as to create a database of the epidemics that we will use later on during performing our national field epidemiology training programs. Up to now, we also developed, based on experience of using EpiInfo, 12 EpiInfo templates for some questionnaires that we are using for searching some communicable diseases. That process is, of course, ongoing. In 2018, we will continue with our cascade trainings, as well as to extend our regional cooperation, especially with some countries from the North Africa and the Near East, and to prepare new training models and courses for 2019. Now you can see a couple of slides from our cascade trainings, one that was done in Budva in May 2000. You can see a couple of couple of Athenians and as well as the Spartanians working together. Also in our training site in National Institute of Public Health. The last one that we finalized just a couple of days before I came here in Petrovac in using EpiInfo software. So early evidence of impact of MediPIET in the public health system of Montenegro is that we are using more and more analytical skills gained in training during our outbreak investigation. Also, international assignment provided information and skills to make first systematic evaluation of adverse events following immunization and reporting, as well as depth analysis of adverse event following immunization reports that was submitted during last 11 years. That was resulted in scientific sound evidence of vaccine safety and really help us to cope with a lot of anti-vaccinal messages. So thank you. It's very difficult to stop now the young fellows and epidemiologists. They are really asking more and more. And I really do hope that at the end of this conference that it will be possible for me to tell them good news that we will continue with this program. Thank you.
Thank you, Nisef. Dear colleagues, dear friends, and honored guests, it really gives me a great pleasure to give you a short presentation of setting up the new system for surveillance of influenza in the country. We started in 2014, and I will give you the overview until now. So just first, short introduction. Macedonia is a small Balkan country with population just over 2 million people. We have a long-lasting history of surveillance of communicable diseases. We have a list of 64 mandatory notifiable diseases, and influenza is one of them. All medical doctors are obliged to report to the local level, 21 centers for public health, local units, 10 regional centers for public health comprise the surveillance scheme, and on top of the surveillance is my institution or Institute of Public Health. The one shortcoming of this system, although robust, it's paper-based, and this imposes some lacks in detection and response to threats posed by communicable diseases. So we decided, as one of my projects, to implement a new surveillance system, namely Sentinel influenza surveillance, with aim of timely detecting the circulating viruses in the country, collecting more precise epidemiological and virological data in order to harmonize our system and be able to report the same data to TESI as other countries in EU, be able to estimate the burden of the disease posed by serious acute respiratory infections and influenza-like illnesses, and of course, because the surveillance is information for action, to implement timely preventive public health measures. So we started slow and small. In 2014, the first season, we started as a pilot project with only 6 sentinel sites in a few health regions covering a little less than 1% of the population. Next season, and next 2 seasons actually, we expanded the network and included 14 sites with almost 1.7% of the population under surveillance. And finally, this last season, we expanded with 2 more sites and we reached the 2% of the population which is under the coverage with this system. And we also received 1 request from other health region in the south to include 2 more sentinel sites in the system, which is good news. So, in the spirit of MediPIET, we strongly believe that in order to maintain the surveillance system, we need a network of trained professionals, which will enable us to be sustainable and have and obtain quality data. Only with training and enforcing the same procedure across the region and within the country, we can do so. But also, not just within the country, we expanded our network with other sectors, like sectors for food and veterinary, and we also collaborated with Albania on cross-border threats in this particular area posed by avian influenza and pandemic influenza under the framework of SECIT, South East European Network for Prevention and Control of Communicable Diseases. This is just a snapshot of what we were able to produce. What we can see is that this system complies good and tracks well with the regular surveillance system. We were able, for the first time with the knowledge gained through the MediPIET, to implement the intensity levels. For the first time as well, we made an evaluation of 1 surveillance system in the country. And we also were able to gain enough virological samples to do virological monitoring of the influenza with less resources. And just for example, in the last season, we already collected 33 samples for viral samples, while none from non-sentinel sites. So just to summarize, what we have achieved so far that we gained and created a network of trained professionals, and it's sustained beyond 2017. Quite contrary, it's growing, so we are certain that this will continue. But also, we work not just within the MediPIET, we link the MediPIET with other networks such as SECIT, and our analysis so far and evaluation show us that we obtained quality and timely data, but with much less resources. We were able to detect the circulating viruses much early than with the regular system. We have now full season, full year-long surveillance system, which provides data out of the season as well, which is very important for detecting new viruses and pandemics. We have now data to start with the estimates of the burden of disease posed by influenza, and we think that we are in good way of harmonizing our surveillance and reporting system for influenza with that across the region and with you, and we are able to report to TESIS successfully. But it's not all roses. We did our evaluation in this out of the season period, and based on the knowledge and shortcomings identified, we improved the database and lab feedback reports to our GPs. We improved specimen pickup schedule so we can have timely pickups and more specimens collected. And we started working on electronic system for reporting in order to lessen the burden to our colleagues. All of this would not be possible with SECIT, which started this project with our workers and co-workers and MediPIET supervisors and scientific coordinators, and of course to MediPIET program and MediPIET team who enabled us by gaining the knowledge to actually implement and further improve this system. So, thank you for your time.
Good morning, I'm Zainab Farah from the Lebanese Ministry of Public Health. I'm from cohort 2. I'll be presenting my experience in MediPIET. So it's a quick summary of my fellowship. As outbreak investigation, I worked on the first H5N1 incursion in domestic poultry in Lebanon. We prepared a paper which was accepted for publication in the Emerging Infectious Diseases journal CDC. For research, I worked on time series analysis of human brucellosis. International assignment, my Ebola mission in Gorn mission in Guinea was validated, and I did another international assignment in Kilpno, Greece. For surveillance, it was one on hospital mortality surveillance among Syrians. Have a presentation on one Thursday on this topic. And the other one, syndromic surveillance in field medical units. This is what I will be presenting today. As you all know, refugee and migrant crises have affected many countries in the region. And especially recently with the Syrian crisis, many countries in Europe and in the Middle East have been affected by this crisis. And Lebanon was one of the most affected countries. We have around 1 million registered refugees in the country for a population of 4.5 million. Syrians in Lebanon, they are mainly living in an area called Bekaa, which is a governorate in Lebanon. They are integrated in the local community. We don't have official camps. 20% of them live in informal tented settlements with in poor conditions and overcrowding and low access to health services. That's why in 2013, national and international organizations started operating field medical units to provide services, health services for refugees, especially those living in informal tented settlements. So at an epidemiological surveillance unit at the Bekaa region, we implemented a syndromic surveillance for these field medical units. We used a weekly reporting form. It is aggregated for 2 age groups, less than 5 and 5 and above, targeting 14 diseases and syndromes. Indicators like proportions, ratios, and distribution by place and time are computed, and results are disseminated in a weekly bulletin. What's the importance of this system at the national level? So this system complements the national surveillance system, and through the system we are able to detect more cases of communicable diseases among Syrians. For me as a fellow, I gained experience in proper implementation and running a surveillance system, and this means also more experience in the field. At the regional level, I did my international assignment in Greece at Kilpno, so the main objectives of the assignment were to help in the improvement of the syndromic surveillance system at points of entry for migrants and refugees coming to Greece, and to support Greek authorities in planning public health programs and vaccination activities for refugees. Again, as benefits for me as a fellow, so we shared experiences with public health professionals in Greece, and I got exposed to other refugee situations. On the other hand, I presented my work in the MediPIET annual scientific conference in 2016. It was also an opportunity to me to share experience with other fellows working in other countries with refugee crisis. Thank you.
Thank you, Zena, for sharing with us your experience. We have seen how the project progressed since the first consultation that was conducted at Verrier-du-Lac in France in 2012. It was a dream, and the dream is now a reality. We are so happy to see the proximal impact of MediPIET project in different countries with different level of integration. We have seen that the regional dimension of this project is very important for us. We have seen that we need to keep this project to be able to enhance all our capacities and to help all countries to reach the global health security. I can see here the first persons who have believed in this project. I would like to thank Dr. Alena, who was the woman that was with us during the first phase of the project, and also Vladimir. They work a lot of us to have the guide. Now, the guide, we need to revise this guide to be more applicable for this regional dimension. I would like also to thank European Union Commission for supporting this project, and I hope that we will continue to supporting us during the next phase. I would like also to thank ECDC for their scientific involvement in this project, for their they were supporting us during this project since April to now. I would like also to ask ECDC to continue to lead this scientific project with us and to keep this boat together. I would like also to thank all public health institutions who were involved in this project, particularly Carlos III Institute, who was the hosting institute during the second phase of the project. I would like to thank all supervisors, all national focal point, all fellows for the hard work they are doing in their daily life. The challenges are still here. We need to continue working and to be together to face the new challenges in our countries. I would like also to thank FIAP, who was supporting us during this phase, helping us to travel, helping us to conduct different modules, helping us to be here in different activities of MediPIET project. Thank you so much, Jose. Thank you for all the team of FIAP. The dream is still here. We need to continue this project. You have seen the proximal impact of the project, but the impact of the project, we will see this impact after 10, after 15 years, when we will reach the global health security. We need to continue this project together. We need to be linked to other networking in Europe and outside Europe. It is a request that we will open the plenary to have some idea to continue the project together. Thank you.
Your Excellencies, colleagues and friends, and thanks to NISAF for mentioning me, and I am happy and pleased to be here after a couple of years when I left WHO and I had to leave this project as a baby, growing baby, as we were discussing in Hammamet in September 2014. So my congratulations to the whole team, to the consortium, and to the whole MediPIET team taking over the project, and I see now how the baby is successfully growing up. So congratulations, and I hope that now I will continue with you ahead, because you have great plans and I'm offering my expertise.
Thank you. Is there other positive input?
Hello, good morning. I'm Paula Vasconcelos from Portugal, which is a country not in the MediPIET, but involved in the MediPIET. So you ask positive things, we have a lot of positive things to say. We were part of the project on a training perspective, as well on international assignment, and believe us, this was for us one very good example of what is cross-border that is not a threat. Cross-border support, cross-border exchange of experience, cross-border minds, cross-border public health engagement. So that's the positive aspect. Thank you.
I did not know I was so destructive with microphone, but really congratulations to where you stand. If we would have said that it's also a dream to see your own FETPs being burgeoning 5 years ago, well, I mean, look back where you stand today and be proud. I think that's for sure. And I think the second element is that we stand in this together. You have achieved it with each other, and I think that's also across the Mediterranean and across the EU and across the different countries, I think a great challenge that you have achieved. So here again, congratulations. And for the Commission, well, I think we'll take the stage back as we go in a few days, but we are carefully looking proudly at what you have delivered.
Good morning, everyone. I am Dr. Wahid Ahmad Lashari from Pakistan, and I will congratulate MediPIET for such a wonderful conference. And the work represented here regarding their achievements is very good work. And the region is working for IHR and global health security agenda is remarkable. And I would like to say that it is a very important time because each and every country is implementing their IHR component in their countries. So I wish best of luck for a very good conference, and thank you very much.
Thank you very much. I'm quite pleased to be here, and I would like to congratulate everybody. I'm Dr. Anajar from Libya. Despite the fact that we've involved in the first meeting, but we've got interrupted. I mean, we couldn't continue in this project because of the challenging situation in Libya. I just would like to draw your attention that some countries in the region probably they're going through a difficult, complex health emergency situation, like Libya, and also the huge influx of immigration. I just wanted to kind of develop a mechanism to involve countries like Libya in the project in the future, because it is very important, I mean, to be on board. Thank you very much indeed.
Libya is very welcome. You are part of the project. We know that you focused a lot of problems that are not among MediPIET, but sure that we will continue all together this project. Thank you.
Hello, everybody. I am Dr. Ghazi Sherkas from Jordan. I want just to comment on the limited part that I participated in the module. I've participated in the Athens module for revision of abstracts. Really, the module was very effective. It was innovative for me. It was something that will help epidemiologists a lot and help researchers and abstract writers how to be just as specific as it's wanted. So it was very organized and very helpful. Thank you all in the MediPIET team. Thank you.
Thank you for highlighting the scientific impact of the project, plus the public health impact and the global health security. The scientific impact is, we will see together during this 3 days conference how we achieve some objective related to this scientific impact, and we are very proud of our project and keep it in this very high scientific level. Thank you.
Hi, good morning. Thank you very much. I think that it has been a pleasure to hear all these presentations. I'm working in the public health training section of ECDC. I've been honored to hear the briefing of the portfolios of the fellows that present their work here at the conference. And I think that the training component is essential. But I'm quite impressed also by the networking, and not only at the regional level, but also how you are addressing the context at the national with the different institutions that need to be involved. And we have heard examples like Montenegro or Moldova, where there have been also important agreements between those different institutions, and also sometimes with others in the EU or in other countries in the network. So I want to congratulate you, because I think that is also a source of inspiration for the EU member states. Thank you.
In fact, what I would like to highlight is that all the countries present here were already working before MediPIET or before any initiative or any project. What makes the difference is that we have been able to put all our small pieces together and to create synergies in order to better implement public health measures to keep our citizenships all over the region, and to provide the decision makers with the proper evidence-based information and reports in order them to take the best decision they could take. And this is the contribution of not only of having money from the funded agency, but also from the high professionalism that there is in the region, the high professionalism that is in each local level of each of your countries, and the capacity to work together and to find synergies and to put all our regional contribution for reaching the global health security. So thank you to each one of you.